Hey everyone, Dr. Morales here. I just wanted to go over why certain things why certain problems take more time to heal, and the reason why behind that. So let's go ahead and get started. I usually just go through everything and just go back to the anatomy. So go back to anatomy. Okay, so what tissues we're working with today, we're working with all the time, are bone, which is very important, muscle, tendon, and then ligaments. Okay, so bone is very important not only because of structure, okay, structural integrity, but also because this is where blood is created. Okay, it creates blood. Okay, now I've listed these here because in order of how much blood flow they get. Now, blood flow is very important because, excuse me, blood is how you heal. Okay, so let me put that up here. Actually, I'll put that right here. Blood is how you heal. Okay, so logic tells us that the more blood flow, the faster healing, right? And so that in that case, that's pretty much true. That general rule is pretty much true. So muscle has a lot of blood flow. Okay, tendons, they have, they do have some blood flow, but not so much. Okay, now ligaments, they're hurting. Okay, they don't even get an arrow. They just kind of, they're there. They get blood flow because they're alive, but they just get blood. We'll just say that. They don't even get the full name. Okay, so let me just go ahead and pause there. All right, so let's go back to just keep reminding ourselves. Okay, and so what we were going through is, why certain injuries take longer. So I'm going to go and give an example of each one. So bone is obviously a fracture, immobilization, that whole thing. I think everyone knows that. So for muscle, it has a lot of blood flow, okay? The bad thing about this is that it will send so much blood to the area that it can kind of clog everything around it, clog all the communication, it clogs the tissues, transferring, nutrients, that kind of stuff. It kind of just dilutes the area, okay, to the point where it's just not helpful. And so that's why when you have a muscle strain or something like that, this is, muscle strain, let's say, like that, we say to use ice, okay? So ice is going to help to limit the pain. It's going to limit the blood flow. And I say that because, like we mentioned before, muscle gets a lot of blood. Okay, so that's not going to be an issue as far as, getting blood. The muscles are not going to have a problem with that. What we're more interested in is decreasing pain, and we want to decrease the inflammation. Okay, that's what we want to do. As long as we can control these two things, the muscle strain itself, you'll be able to heal. Okay, again, because of a lot of blood flow. Now, if we go into the tendons, so this would be something like tendinitis. Okay, like tennis elbow. Oops, I can't spell tennis. There we go. There's two N's in there. Okay, tennis elbow. Oops, elbow. And then there's things, it could be also be things like an ACL. Well, that's more of like that's a ligament. Tendinitis, oh yeah, that's right, Achilles tendinitis, okay? While there is blood flow, remember we only gave it one arrow. There is blood flow to the area. It's not going to have a lot, okay? So ice is going to be helpful for the pain. And inflammation, but there's not going to be so much inflammation just because there's a tendon. Okay, the tendon doesn't have so much blood. Now, there's different grades to muscle tears and tendon tears and things like that. We can go into that in a different video, but that will also bear a weight on, you know, how much ice and, you know, the duration and all that kind of stuff. Those are details for a different day. But anyway, ligaments, okay, this is going to be something like an ACL or PCL tear, okay. It could also be small ligaments, right? Small ligaments in your hands, small ligaments in your elbows. I'm sure, you know, pee-wee, baseball, sometimes even football. You know, you can sprain your elbow from, you know, getting pushed like this for so many times, or maybe you fall like this and you sprain your elbow going that way. Or pitchers, I see this a lot when they try and throw a sidearm. They lead with their elbow and then they have to snap it. You know what I mean? So that it's not just the knee, it's just that's an easier example. But anyway, so I'm sure people have you know, the ACL PCL injuries, everyone pretty much knows that, you know, it's a very, you know, it's a long process to heal, and primarily it's because there's not a lot of blood flow. Now, a lot of times what you'll see for treatments with ligaments will be cupping. And you can do dry cupping or, I guess, wet cupping. Like you use an emollient. Dry cupping would be like smoke. They use a smoke fire type of thing. I've never used that before. I would usually use an emollient, like a little like solvent, like a little lotion, just to make contact. But anyway, so the idea is to suck the blood out of the area to enhance blood flow and kind of not rush, but, you know, kind of move things along, usher the blood, you know, the old blood cells out of the injured area and into the body's, you know, system to get it flushed out. So you'll probably see cupping around the knee, maybe on the quads. So if this was the knee right here, this is the lower leg. So the ACL injury is right in here, and so you'll probably see cupping right in here, and possibly in the hamstrings in the back as well. I mean, it just depends on what's going on. So I just wanted to give an idea of, you know, why certain things take longer to heal. A lot of the patients that I see, and a lot of the patients, and a lot of you viewers out there probably have low back pain that is just, you know, constant, or just not constant, but it's just kind of, it's always there. It's just kind of like, you know, it'll be okay one day and it'll, you know, kind of flare up the next. And so, you know, speaking about blood flow and things like that, when you have a low back strain, you know, we go back to the anatomy, muscles have a lot of blood flow, right? And so, muscles in the low back, increase blood flow. Okay. We mentioned before that when muscles get hurt, blood rushes to the area to try and help and heal. Now the issue again with that is sometimes it'll get put too much and it'll clog the area and essentially create pain, because when that area gets too swollen with blood or with anything really, sometimes it could be like a serous fluid, you know, I'm sure you've seen weeping wounds, things like that. It's not necessarily blood, but it's not, you know, it's not saliva, it's kind of something else. So it could be other things like that that are within the tissues. And when that expands and you know, there's literally no more room for it to go, that's when you get a lot of pain. Okay, and so that's why we want to, you know, decrease the heat, put some ice. So what I'm kind of getting at though is, you know, that's all fine and good, but a lot of times people see an increase in their low back pain or their neck pain or what have you, their injured area or chronically injured area, and they feel it a lot more when they're stressed. Okay, so when there's increased stress, what happens when you're stressed, right? The first thing you think of is your blood pressure, right? Increased stress equals increased blood pressure. Okay, blood pressure is literally pressure within the arteries. Okay, and you have arteries everywhere, everywhere, everywhere. And what do the arteries carry? They carry blood. Now, what does the blood do? It increases when you're stressed. And what does that do to the injured area? It increases the blood flow. Now, what does that do to the area? It gets it really super swollen. And you don't like it when it's swollen, right? And that's why one part of, low back pain, low back strains, things like that, is linked to stress. When people can't handle their stress, or understand how to, everyone gets stressed. I get stressed all the time, but it's a matter of how you handle it, right? And understanding what stresses you out and understanding how to avoid it. That way we can, keep that blood pressure low. So that is, another thing that I'd like to kind of get on your guys' radar as far as how does this connect with me, with my everyday life. This right here, stress. Okay? Stress can do it. A lot of people think, oh, it's just stress, it's fine. All I have to do is go to the gym and it's fine. Okay, yeah, great. But if you're still stressed in your brain, if you're still stressed in your little brain in here, okay? Your brain is the control center for your whole body, okay? Now, if you can decrease your stress, the likelihood of your low back pain coming back or flaring up again as often as it used to goes down, right? Incidentally, you train yourself to not get stressed, to not have that worry, right? And those kinds of things are very important nowadays. Don't stress the small stuff, right? And it's all small stuff. It's all small stuff. Okay? Okay, guys, so I wanted to go over, ways to decrease your stress. So, because you're just like, okay, Doc, well, what am I supposed to do? I got the kids, I got my mother-in-law, I got this, I got that, I got, this going on, and, my other, ailment, and, I don't know what else is going on. So, ways that you can decrease your stress is to just breathe. Okay? Take a breath. Okay? Figure out why you're stressed. Maybe the consequences of what you're stressed about isn't as bad as you think. Drink some water. We all need to drink water. Water is something that will help to flush out all the different fluids that get secreted by your system, whether it be lactic acid or stress hormone or I don't know, other things that your body, sugar in your blood. Water will help to dilute and set an equilibrium to your system. Okay, because the more water you drink, I'm not saying to drink 2 gallons in an hour or anything like that, but what I'm just saying is to keep yourself hydrated, is to keep things in your body moving, right, on a cellular level. Okay, and movement is life, right? Blood is life. Blood needs to move, right? So anyway, take a breath, drink some water, and I also want you to go outside. Okay, be in nature as much as you can, as close to nature as you can. Okay. Seeing water, seeing plants, watching the wind hit the leaves and flow. It'll take your mind off of what is immediately in your purview, and it'll allow you to understand that things are going to be okay in the long run. In the long run, it's all going to shake out. Okay. Now, I'm not going to limit you to these things. I mean, yeah, you can do these things in 5 minutes, right? And hopefully your stress is down. Then this will, hopefully getting outside will make you want to go for a walk, right? Maybe you go for a walk. Maybe you have to take your pet out. Okay. Stress is a way of your body telling you that, not that you can't handle whatever you're doing right now or whatever situation's happening, but that you're not necessarily in the right mindset to handle it right now. Okay. Stress is another way of your body connecting to you, communicating to you, trying to tell you how to help it. Because it wants to help you, right? Because it's you. You're trying to help yourself. Well, I hope this was helpful in understanding maybe what's going on with you, right? I'm always going to go back to the anatomy of, how's your posture? Are you drinking enough water? When's the last time you got adjusted? That kind of thing. But I'm also gently remind people to understand the mindset is very big as well. The mindset is very big as well. It plays a huge role. I'll put right here, mindset. Very big. The mindset of someone who is maybe views themselves as a victim, or maybe views their life as I don't know, anything negative. They're gonna see what the mind is seeing, right? So the mind is set on what, right? So it can go two ways. Your mindset can be pivoted to, grace, giving yourself grace, gratitude maybe for getting yourself this far, loving yourself. Or you could have a mindset of negativity. Oh yeah, that's the one. I was going to put positive. You could have a negative mindset, okay, where you think everyone's out to get you. Nothing works for you. Oops. For you. Or maybe nothing like that. Maybe you're just really hard on yourself. Maybe you're just like saying to yourself, I should have, right? Or I could have, or why didn't they? right? You're just dwelling on so many different things. You see how many different things I have right here? But being positive, being loving to yourself, gratitude, having gratitude for where you're at, and giving yourself grace to feel a little, you know, a little down maybe, or a little stressed, and that's okay. Just bring yourself back. Bring yourself back to the positive, loving gratitude. Okay? All these things will decrease your blood pressure. Okay? And this will regulate your system, your nervous system. Okay? Which is exactly what we're working with, right? Your nervous system. Your nervous system needs to be regulated. Make sure that it's regulated, right? We all know it has a fight or flight. This is not news. It can go two ways, right? It can go two ways. Negative, positive, negative, positive. Okay? Fight or flight is neither negative or positive in either way, and in any, like, you know, doesn't mean anything negative or positive in either way. However, there are two options for your nervous system. You can do fight, flight, or you can do rest and digest. Oops. I'm running out of board here, but I'll just put rest and digest. So there's two: fight, flight, rest, and digest. Okay? This is what we want. I want this to be a heart. There. Something like that. So we like it when our system is in a rest and digest state, right? Because we're not trying to fight and we're not trying to run for our life. We're trying to rest, and we're trying to digest the food, the nutritious food that we're able to eat, right? And we're gracious to ourselves. We're grateful for the food. But in fight or flight, this is nothing. We couldn't care about that, because we gotta make sure that we survive, right? So we want to make sure that we're in this rest and digest mode as much as possible. Okay? This will help you heal a lot better. So, for those of you who are still here, thank you for hanging on. I just kind of went on a tirade. But just to recap, right? So, we always want to go back to the anatomy. Go back to anatomy, okay? The tissues that we're working with are bone. This is the one that creates the blood. Very, very important. Very, very important. That's supposed to be a star. Okay, then we got muscle, tendon, and ligament. I can go into do a deep dive in each one of these, and that will be fun, but not for this video. If you guys do want a deep dive in any one of these or all of them, let me know. I would be happy to go through it with you guys or for you guys, because I know there's a lot of people out there who want to know why, and I want to know how, and all the things, but I want to focus on what you want me to focus on. So go ahead and leave a note in the comments saying, you know, what you want me to go over, or what you want to learn more about. Yeah. So we went over that, and that. And then we went over blood flow is how you heal. Okay. And then we kind of went over examples of each tissue. Okay. Then we kind of went into mindset. Mindset, huge, right? Because if you break it down, mind, set. What are you setting your mind on? Are you setting your mind on negativity or positivity? You have the choice. Okay? I think that's why they say happiness is a choice. Because you have the power to set your mind on a positive rather than a negative. But anyway, thank you guys so much for tuning in to my channel, AMC Movement. Again, I just like to help people understand how to move better, why they need to move better, and answer any questions they have. So have a great day, guys.